Hi everyone, this is Mahmoud Raza. In our previous two videos, we discussed about insulin resistance and prediabetes. So today our lecture is about type 2 diabetes. So this picture I have taken from thumbnail to just explain about diabetes and the abnormalities caused by diabetes. So this is a diabetes monster which is causing several problems, health issues like heart attack, stroke, eye damage, dental problems, kidney failure, Alzheimer disease, nerve damage, which is leading to foot amputation sometimes. This monster is causing several problems, but slowly, and sometimes symptoms are not shown or not clear. So that's why this is a kind of silent killer. Type 2 diabetes is a chronic illness where blood glucose levels are higher than the normal limits due to insulin resistance. We have already discussed in our previous two lectures, and relative insulin deficiency. So we have already discussed these two conditions in our previous lectures. So continuously higher glucose levels put extra pressure on the pancreas to produce insulin massively, which is affecting the efficiency of beta cells of pancreas. So they wear out and are unable to produce the required amount of insulin to regulate blood glucose levels, resulting in elevated blood glucose levels and slowly converting to type 2 diabetes. This medical condition develops over several years. A patient may not have any symptoms, therefore it's a kind of silent killer. So what is the significance of the disease? The way your body uses sugar or glucose for energy is impacted by type 2 diabetes. If we don't treat it, it prevents the body from utilizing insulin as it should, which can result in elevated blood sugar levels, leading to serious health issues such as heart attack, stroke, and kidney failure, and some other abnormalities we have already discussed in our previous slides. So what are the factors leading to type 2 diabetes? There are several factors. Prediabetes, genetic factor. So another is excess body fats, lack of physical activities, high carbs and processed foods. We have also discussed in our previous lecture in prediabetes about high carbs and processed foods. So how type 2 diabetes develops? So we have already discussed about our body cells like adipocyte, hepatocytes and muscle cells. Insulin resistance causes high blood insulin levels to overcome resistance and regulate blood glucose. Continuous high rate of insulin production leading to beta cells dysfunction. Due to these conditions, our body cells become less efficient to uptake glucose, leading to a high glucose levels in the blood, which is known as hyperglycemia. It's a hallmark of diabetes. So these are the complications caused by type 2 diabetes: heart attack and stroke. So atherosclerosis is a medical condition developed due to diabetes. What is atherosclerosis? It's the accumulation of cholesterol, lipids and other substances in the arteries, which is increase the risk of heart attack and stroke. Kidney failure. High levels of glucose in blood can damage the tiny blood vessels in the kidney, which causes leaking of albumin in urine. This condition is called as proteinuria. So it can damage eye. High blood glucose in the bloodstream can damage the small blood vessels in the retina, causing loss of vision. Diabetes causes gum diseases, slower the healing process after dental procedures, reduces saliva production leading to several oral issues such as tooth decay, gum problems and infections. So other complications are Alzheimer's. There are several studies shown that diabetes is a risk factor of Alzheimer's disease. Nerve damage is another complication which affect the messages or signals to different parts of the body. Foot amputation. Diabetes can damage nerves which can result in gangrene, infection and foot ulcers. It may result in foot amputation if left untreated. So we have to be very careful and manage blood glucose levels, type 2 diabetes properly. Otherwise you can see the complications. How we can diagnose type 2 diabetes? There are many tests, but usually we are using HbA1c, fasting blood glucose sugars, postprandial test. It depends on the doctor choice. So HbA1c does not require fasting. It provides an average of blood sugar levels over the past 2 to 3 months. Fasting blood sugar require fasting 8 to 12 hours and you can drink water. Postprandial testing requires testing after 2 hours of meal. These are the reference ranges. Normal ranges for fasting is 100 mg per deciliter. HbA1c less than 5.7%. Postprandial 2 hours 70 to 139 mg per deciliter. So pre-diabetes zone we have already discussed a lot in previous lectures. The diabetic limit for fasting is 126 mg, equal or more. HbA1c 6.5% or more. 20 mg per deciliter or more is for postprandial 2 hours. These other tests are linked with the diabetes lipid profile. Why it's important? Because type 2 diabetes causing diabetic dyslipidemia, where you have high cholesterol, high triglyceride, low HDL and high LDL. In kidney function, creatinine, blood urea nitrogen, urine microalbumin, albumin creatinine ratio, these tests are very important to diagnose kidney issues. LFT is for liver function. So liver is a key player in glucose and lipid metabolism. High glucose levels can affect the liver, so that's why it's better to add LFT also in your diabetic panel. Usually in diabetic patients, they have frequent urination. Because of this issue, maybe sometimes electrolytes are imbalanced. So question answers. Which test is useful to manage diabetes? There are several tests to diagnose diabetes, but you need to know that which test is good to manage diabetic patients. So usually doctors advise HbA1c test for the management of diabetes mellitus. They establish a target of blood glucose HbA1c levels at least less than 7%. Is diabetes life-threatening? Diabetes is a silent killer that damages body parts such as kidney, liver, eyes, nerve, heart and blood vessels. It kills like a slow poison. Are there any further tests needed? You should be aware of state of various body parts because diabetes has an impact on multiple organs. When you go for general health checkup, so it's better to add kidney, liver, lipids also in your blood testing. Can we live healthy life with type 2 diabetes? Yes, it's possible by following balanced diet, regular exercise, weight management, monitoring your blood glucose levels, using prescribed medications, regular checkups and consultation with your doctor. Thank you so much. If you like this video and presentation, please like, comment, share and subscribe the channel. Thank you so much.